I'm going to talk to you today a little bit about buprenorphine, or the treatments for opiate addiction. So one of the treatments for opiate addiction is a medication called buprenorphine. The brand names of buprenorphine are things like Subutex and Suboxone. The difference between Subutex and Suboxone is that Suboxone has naloxone in it. It's another drug. It's a combination drug of buprenorphine and naloxone. The naloxone is only there as an injection deterrent. So if you inject Suboxone, you will go into withdrawal, where Subutex does not have any naloxone in it. So the way that they work is that buprenorphine, the active ingredient in both of those drugs, is it activates the opioid receptor in your brain. So it is an opiate. It is an opioid, just like heroin or just like opiate pain pills, but it works a little bit differently. It activates the receptors, but it only activates them partially. And that has a couple consequences. One of them is that you don't get high when you use. There's no euphoria associated with Suboxone. And it's very, very, very long acting, so there's no ups and downs, there's no withdrawal and euphoria cycle. So you activate the receptors in your brain so that you don't crave. So it takes away cravings, but then it also holds on to the receptors very, very, very tightly, so that if you do try and use heroin or some other opiate pain pill, it just sort of bounces off the receptor. You don't feel it. It's taken as a sublingual tablet, so it means under your tongue, and normal doses are about 2 to 20 milligrams, up to 32 milligrams per day for opiate addiction. So it's a little bit different from other medications in general because only certain doctors can prescribe it. And the reason for that is a little bit complicated and political, but basically they don't want any doctors prescribing it, so that they want to prevent like pill mills. So in order to be able to prescribe it, you need to take a certain class, basically, and pass the test for the class, and then register with the DEA, the Drug Enforcement Administration. So basically the DEA tracks everybody that prescribes Suboxone. And so the DEA also sets limits on how many patients each doctor can have. So in your first year of prescribing Suboxone, you can only have 30 patients. Subsequent years, you can have 100. The Obama administration just passed some legislation that allows for certain physicians to have 275 patients on Suboxone, and they have pretty strict limits on who can do that. You have to be an addiction medicine physician like myself, and you have to have certain other supports within your practice, like a treatment program. And so that's why there aren't that many people who do prescribe it. So probably within Minnesota, there are probably about 100 prescribers of Suboxone. So that's what Suboxone is.